All right, so we'll start the session. Okay, so today's session is going to be on ABG interpretation. Yes. So ABG interpretation. So I've got few case scenarios for you. So we'll just try to solve those cases, right? So this may not be the only session on ABG interpretation. So we'll have subsequent sessions also in future, wherein we will try to solve the cases. Only then we'll be able to master this ABG interpretation. All right. So hope you had seen the video on acid-base disorders before this, but even otherwise, it's okay. But after this, you just go and watch the acid-base disorders session, right? Yes. So because you should know about the causes, right? Causes of each of the acid-base disorder. So for that sake. So let us start off with the basics of acidosis and alkalosis. I hope you all know this, right? So what is acidosis? So what are the parameters that we would look into whenever we diagnose acidosis or alkalosis? The parameters will be, the first thing is pH, right? So acidosis is always a reduced pH. So a fall in pH, when it is accompanied by a fall in pH, you call it as acidosis. When the fall in pH is accompanied by a fall in bicarbonate, then what you would call it? Yes, this slide that I am teaching you, it may be confusing. You may not be able to diagnose it in first place, but still just keep. But you know the concept, so that will be the scenario in for everyone. Okay, we know the concept, but still will not be able to apply it suddenly in any case that we got, which we get. So just master this one first. Yes, good. So less reduced pH, fall in pH, when it is accompanied by fall in bicarbonate, then we would call it as metabolic acidosis, right? So again, fall in pH, when it is accompanied by increase in PCO2, then we would call it as what? We would call it as respiratory acidosis, is it not? Yes, respiratory acidosis. So please understand the arrows here. Fall in pH will be explained by either decrease in bicarbonate or increase in PCO2. Now, who will come for compensation? So for compensation of metabolic acidosis, what will be there for compensation? Respiratory component will come for compensation. In that case, the respiratory component, it will try to reduce the carbon dioxide content. But because we know carbon dioxide is a source of acid, is it not? So it will try to reduce the carbon dioxide content by hyperventilation, right? By hyperventilation. Now, what will be the compensation for respiratory acidosis? Who will come for compensation? Metabolic component, that is the bicarbonate component, your kidney. So what will happen here? What will happen to the bicarbonate levels here? The bicarbonate levels should be reduced. The bicarbonate levels should be increased. No, the bicarbonate levels should be increased here for compensation. So the kidneys will try to reclaim more bicarbonate from the tubules. So this is what happens in case of compensation. But how much carbon dioxide should be reduced in case of, metabolic acidosis, or how much bicarbonate should be increased as a compensation for respiratory acidosis? We will see that in the next slide, right? So next is, what is alkalosis? Alkalosis means what? Alkalosis is an increase in pH. So the increase in pH will be explained by, increase in pH should be explained by increase in bicarbonate. Then what does it mean? What does it mean? Increase in bicarbonate, increase in pH, then that would mean metabolic alkalosis, right? So increase in pH, if it is explained by reduction in the PCO2, then it should be respiratory alkalosis, right? So who comes for compensation again? In case of metabolic alkalosis, the compensation should be increase in the carbon dioxide. So increase retention of carbon dioxide by hypoventilation by the lungs. Similarly, in case of respiratory alkalosis, what will be the compensation again? The compensation will be reduction in the bicarbonate levels. So there will be more excretion or reduced reabsorption of bicarbonate by the kidneys. So this is what is all about, right? Acidosis and alkalosis. So we will be looking into the values of these acidosis and alkalosis, and we will diagnose whether it is metabolic acidosis or alkalosis or respiratory acidosis or alkalosis. Is it fine? So next we'll see what is a compensation formula. Compensation for metabolic acidosis is what? For metabolic acidosis, what will be? So you know the primary change, you know the compensatory change. Yes. So what is the compensation here? PCO2, expected decrease in PCO2 is going to be 1.5 into bicarbonate plus 8 plus or minus 2. Please note it down somewhere. So it is 1.5 into bicarbonate plus 8 plus or minus 2. Similarly, for metabolic alkalosis, here they have given this kind of a compensation, that is PCO2 increases 6 mm mercury for each 10 milli equivalent rise in bicarbonate, but we also have a formula 0.9 into bicarbonate plus 16 plus or minus 2, right? Similarly, for respiratory acidosis, we have two phases. One is an acute respiratory acidosis or a chronic respiratory acidosis. If it is an acute respiratory acidosis, then increase in bicarbonate will be 1 for each 10 mm rise in carbon dioxide level. Similarly, for chronic, it will be increase in bicarbonate by 3.5 for each 10 mm rise in PCO2. Similarly, for respiratory alkalosis, again, we have acute and chronic compensation. Here, the decrease in bicarbonate will be by 2 for each 10 mm fall in carbon dioxide. Similarly, for chronic phase, it falls by 5 for each 10 mm fall in carbon dioxide. So what is that you should remember? For respiratory acidosis, acute phase, it is 1. Chronic phase, it is 3.5. Alkalosis, acute phase, it is 2. Chronic phase, it is 5. So remember these numbers. All right. Yes. So we'll start off with each scenario. So we'll start with simple cases with, just complex case. And also even more, we will discuss in the subsequent sessions also, right? So first thing is a 76-year-old woman is admitted to ortho what? Following a fall that is resulting in fracture neck of femur. She has a fruity odor to her breath. What's the ABG result is shown below, and how would we interpret it? First, look at the pH value. So what's the normal pH value? It is 7.35 to 7.45, right? So it is 7.35 to 7.45 is what is normal. So